Hi, this is the recording on chapter 13 and 14. Chapter 13 is skin, hair, and nails. Um, Structure and function. Think of the skin as the body's largest organ system. It covers 20 square feet of surface area in adults, and the skin is uh, sensory. It guards the body. It guards the body from stress, trauma, pathogens, dirt. It adapts it to other environmental influences like heat and cold as well. The skin has two layers. The two layers that the skin has is the epidermis. The epidermis is the outer, highly differentiated layer, and then it has the basal cell layer, which forms new skin cells, and the outer, horny cell layer of dead keratinized cells. So the epidermis, which is the outer layer of the skin, contains the basal cell layer, that is what forms new skin, and then the outer horny cell layer, which is actually the dead keratinized cells. The dermis is the inner supportive layer. The inner supportive layer um, contains the connective tissue or collagen, which gives you that elastic tissue, you know. And then there's the beneath these layers is what they call the subcutaneous layer. The subcutaneous layer is the layer of adipose tissue or fat tissue, as you may want to say. So you start off with the epidermis, you go to the dermis, and then you go to the fat layer. Right here is a picture, and in the picture, it has just like a view of what you would see if a person was to cut out the layers of the skin. Um, you have the epidermis, which you look at it, and on this picture, it looks pretty small, and it has the horny layer. Remember, we said that was the dead skin layers, and then the basal layer, which produces new skin. Uh, and then you'll see where actually the hair follicles grow out of the epidermis. The dermis, which is a quite a wonderful layer that has like contained is the hair, the actual hair follicle. You have apocrine and eccrine, which is sweat glands, sebaceous glands. Um, you have the melanocytes for skin pigmentation, uh, connective tissue, all of those type of things. Then some blood vessels are contained within the dermis as well. Um, then you have the adipose tissue, which is the subcutaneous tissue, and which stands for fat tissue below the dermis. So this will give you an idea of what is contained within each layer of the skin. So what they call epidermal appendages, and the appendages is something that kind of almost like it's part of something, but it grows out of it. So you have epidermal appendages, and epidermal appendages is stuff like structure uh, that are in vaginated into the epidermis, into the underlying dermis. So then you have like the hair, that's considered an appendage. Sebaceous glands, sweat glands, sweat glands being things that are good to regulate our fluid balance and thermoregulation. One knows that your sweat glands are a way of cooling your body off. And then you have the nails. The nails are also considered an appendage. So there are functions of the skin. The skin is waterproof. The skin is protective and the skin is adaptive. What does that mean? So, um, the skin tends to protect the person from their environment, so that various things cannot just get into your body. So, it minimizes injury from physical or chemical or thermal or light waves. Then it prevents penetration. Skin is basically like a barrier that stops invasion of microorganisms and loss of um, fluid and electrolytes. Skin is good for perception. And when you say perception, how you look at things. So um, the perception part is when you think of terms of neurosensory organs, like for touch, pain, temperature, pressure. Um, Skin regulates the temperature. It allows heat to dissipate through the sweat glands and heat storage through the subcutaneous insulation. Skin is good for identification. Um, you can look at a combination of facial characteristics, uh, that people have that are unique, as well as hair, skin color, and even fingerprints as a form of identification. And nowadays, even things like people adding things on, like for instance, a tattoo or something like that is a form of identification. Skin is good for communication. You can express your emotions um, through blushing, which is through, for instance, a vascular signal. Um, Skin is good for wound repair. It allows cell replacement of like surface wounds. When you get a wound, that's how it heals. Absorption and excretion, which means skin allows limited excretion of some metabolic waste by products of, I could say, cellular decomposition, such as minerals, sugars, amino acids, which is proteins, cholesterol, uric acid, and urea. So that absorption and excretion, just like for instance, if you see someone and um, that person may shower and may do whatever, but they may metabolize things through their body, and even though that person may be um, clean or whatever, you can see a person sweat out, alcohol. They may smell like alcohol or something like that later. So absorption and excretion. And then lastly, the skin structure and function is for production of vitamin D, which through the ultraviolet lights that converts, like that you get from the sun. It really converts with cholesterol into vitamin D. So we talked about we do our little quiz questions, and so the functions of the skin include all the following except, which means except which one doesn't include the function. So A would be protection by minimizing injury, which really, yeah, it does that. C would be communication through vascular mechanisms. We just talked about that. And D, production of vitamin D, in which the surface converts ultraviolet lights into cholesterol. We talked about that. So I'm just going to go in and give you this. It's B. B would be the correct answer because this is something that the skin does not do. It does not promote penetration, it stops penetration, and it doesn't facilitate invasion. It stops invasion of microorganisms and absorption of water and electrolytes into the body. Okay, so You'll be taking your history, and within you taking your history, you may ask several health questions. You may ask that person, do they have a past history of skin disease, allergies, hives, psoriasis, or eczema? You know, when you're going down, and this is part of what we do when we're working on our checklist, you know, and I'm lecturing to you guys and I'm telling y'all these various things. Change in pigmentation or color, um, change in mold size, shape, color, tenderness. You want to ask all these different questions. Are a person itching, or they have an excessive bruising, rash or lesions? Are they on any type of medications, prescription, and over the counter? You're going to ask a person all of these things, or listen to a person when they tell you, once you answer these things. Do they have hair loss? Have they had changes in the nail shape, color, or brittleness, environment or occupational hazards? Self-care behaviors, how well are these people at taking care of their skin? There are a lot of different things that can happen to a person, and these things can happen to a person based on age and that type of thing. So you may want to look at an individual's age and look at self-care behaviors. Um, for instance, in infants and children, you may have initially they are covered with what they call lanugo, Lanugo, and that's like a little fine kind of hair of the newborn infant. Um, you may look at what they call vernix caseosa, and that's the thick cheesy substance uh, and sebum and shedding of epithelial epithelial cells. You know, when you're looking at a person, you want to look at their epidermis and a child as they grows. You know, their skin tends to thicken and it tends to toughen. So you're going to be looking at all of these different things. In a pregnant woman, for instance, you may see this line and it's on their skin, and it's the line that goes vertically down the center of their abdomen when they become pregnant. This line is called linea nigra. They may have cholasma, which is another name for the mask of pregnancy on their face. They may have striae gravidarum, which is another name for stretch marks. So all or spiders as well. The aging adult, you're going to look at their skin and you're going to see that the epidermis tends to get thin out and it tends to flatten, and you're going to be more worried about them having a, a, breakdown in their skin because it's not as thick as it was when they were older. They're because they lose elastin and collagen and subcutaneous fat in their body, and then they have a reduction in the muscle and tone of their skin. So you may be looking at this, you know. Some older people, they have like vascularity, and and because of the fact that their vascular areas are more frail now, um, there may be little increases in minor trauma, and it may produce dark red discolored areas on the skin. And you may have seen that on an older person, and that's called senile purpura. So you may look at all of these different things and you may put it together, and you may notice or be aware that these are different things that tend to be what they call a normal occurrence in African American, I mean, in children, pregnant women, and older people. Also, when you look at in terms of culture and genetics, you may notice that there are things that go on with Black people, for instance, or African American. Um, um, you may be aware that, for instance, um, melanoma or skin cancer is 20 times higher among whites than among African American because of the and Hispanics because of the fact of the melanin in their skin. So you may be more prone to look at that type of things. There are several groups of people, especially Black people. Black people tend to have uh, or be more prone to keloids, and they are scars that form at the site of a wound that grow beyond the normal boundaries. Um, because African Americans have very compact bundles of collagen just below the epidermis, they may be more prone to having keloids. Um, Hyper or hypopigmentation may appear as darker light spots in Black people. Um, Also, some Black people may have what they call razor bumps or ingrown hairs because of the way that the elasticity of their hair. And so when they use electric or straight razor, they may get razor bumps, and that's called pseudo folliculitis because of the fact that their hair grows back into their skin a lot of times. So you want to look at all these types of things when you are getting your information. And one important thing, you guys, that you may want to ask is whether or not something is a new occurrence or whether or not something is old occurrence. So you may ask, if they you see a person with hair loss or something, or if a person has an area on their skin, has this been on here? How long have this been here? They may have been born with it. Okay, has it changed? Has it done anything different? And then that's when you go into that mnemonic, that ABCDE. So the mnemonic ABCDE is when you're assessing for abnormal pigmented lesions. So you're going to look at A, B, C, D, E, and you're going to look at, as I have here on the slide, it's asking about characteristics of pigmented lesions include all except. So what you're looking is you're looking at asymmetry or irregularity, you're looking at border, irregularity, characteristic variations, diameter, and evolution. So the answer would be the characteristic variations, because that's not the C. The C is actually color variations. If they said had something, and let's say it was brown and then all of a sudden it turned red in color. So it's not necessarily characteristic variations of the is see, it would be color. So you do your preparation always, just like you do your preparation for most things when you're assessing a person. And you want to have strong direct lighting, gloves, pen light, and a small centimeter ruler. That is the equipment that you will mostly need when you're getting ready to examine somebody skin. Um, for special procedures, you may also have what they call a Woods light. Woods lights are filter ultralights, and when something is like, for instance, what it does is it may pick up a fungus of something, or infection, and or a ringworm or something, because like when you shine it on that part of the skin, what it does is it turns like a fluorescent blue green up under the light. Then you have magnifying glasses, and then materials for laboratory tests. Like, for instance, if you clip a little area off of somebody's skin or take a piece of skin, you would put it in potassium hydroxide and they would put it on the slide and they would look at it and they could tell whether or not it was cancerous or not. So, so when you do the, you always, when you do your complete physical examination, you assess the skin throughout the examination. You're going to scrutinize the outer skin surfaces first before you concentrate on underlying stuff. So, first of all, you're going to look at everything on the skin, and you're always asking because, like I said, sometimes some things are what they consider normal variations, whether or not they've had this all their life, whether or not it's irritating them, it's bothering them. If you have someone who is obese or you have a woman that has a large breast, you're always going to look up under those folds just to make sure that they don't have some type of fungus or that type of thing. And you're constantly instructing people when you're examining them of ways to take care of their skin. So you're going to inspect them thoroughly. And because those fold areas are dark and warm and moist, they can provide a very good petri dish, more or less, for irritation and or infection. So you want to make sure that you check those type of things. And you always inspect the feet, toenails, and between the toes, you guys. When you have people with decreased circulation, such as diabetics and different things like that, you want to make sure, you guys, that there's nothing that they're where they're hurting or there's nothing that's broke down or there may be a lesion that may be turning into something more or something like that. That's why they tell a lot of times diabetics don't let anybody else cut your toenails or something. And that's mainly if it's like what they consider a brittle diabetic, somebody who has not stabilized, or if it's somebody older. You can tell a lot by feet and toes. Sometimes people toes thicken as they get older and stuff like that, or if they may not be older, but that's just maybe lack of circulation to that area. You want to notice, and we talked about things like clubbing in their fingers and their hands, and we talked about how you hold people, a person holds their hand up, and that's called the profile sign. And you can actually look in your text and you can see a picture of what they're considering uh, clubbing. Early clubbing starts at 180 degrees, um, and if it is um, if the angle between the like nail base and the nail is normal, which is 160 degrees or less, then that's fine. So anything up above 160 degrees um, basically means that that's early clubbing, and you can tell when um, it goes up to like 180 or whatever, that's a sign that a person is having clubbing, and that's related to things like cyanotic heart disease, lung cancer, pulmonary diseases, that type of things. Okay, so that happens for you to know about people and stuff. So as far as color, um, dark skinned people may have brown or black pigmented areas of linear bands or streaks along their nail edges. Um, some people may have white hairline linear markings from just hitting their nails or trauma. And it's called, I think it's Leuko Nikea, and they know any. So you're just looking at any abnormalities or anything that's abnormal. And of course, we already talked to. It shouldn't take any longer than 1 to 2 seconds. We usually say make it less than 3 seconds when you assess a person for their capillary refills, because you don't want to assess it and find out that they have some type of cardiac or respiratory dysfunction. That's just the way you assess it. And that they used to tell people all the time, that like even when they would be getting ready to go to surgery, to make sure that they take off nail stuff and all that kind of thing like that, like polish and that, because they wanted to be able to assess their nails. Um, so we already know about this slide here, and we came to the conclusion that um, the small red points throughout was what is considered abnormal. And then these other variations, like the muddy color, the yellow fatty deposits, or the small brown macules that are in the sclera, or what they consider normal variations. So you're palpating the skin. I did want to talk to you a little bit about color change. Color change, as far as the skin, such as paleness, erythema, which is redness. So paleness could mean lack of oxygen, or it, like that, as well as it could be just that person's pale in color. Erythema, red, could be a sign of a person having infection possibility. But like I said, you know, that is could also tell you a person is they could be blushing, cyanosis, blue, lack of oxygen, or jaundice, yellow. So note if a color change is something that's just happening, which means it's just transient and it goes away, or whether or not it's possibly related to some type of pathology, which means something's going wrong. So when you inspect the person, and you inspect the person um, with a feel, you use the back of your hands to palpate the person, and that helps you assess the temperature and whether or not their circulatory status. You're looking at the person. You're assessing whether they have hypothermia or hyperthermia. One is cool and one is hot. Heat. Hyper is heat. You want to see whether or not that person has diaphoresis, or whether or not the person has dehydration. Diaphoresis mean that an individual may have um more, like there are some people that tend to sweat more, and that type of thing, than other people. You may look and see. Okay, so then you have what you call let me see, I said you have some people who do tend to sweat a lot, hyper diaphoresis, and then you have dehydration. Where do you check? What's the most important place to check for a person when they have diaphoresis? You are checking the person at their clavicular area, and you want to see whether or not their skin has that bounce back. So you're going to inspect the person, and you're going to inspect texture, whether it's full, smooth and firm. You're going to assess thickness, whether or not uh, it's uniform, whether or not there's edema, swelling, and that's rated 1 plus to 4 plus, you can literally stick your finger in their skin and you can see how quickly it comes back. Like for instance, 4 plus, it just stays there, the indentation, you know. We already talked about mobility and turgor and assessing for that. Um, you may want to look at multiple bruises at different stages of healing and excessive bruises above knees or elbows, and it should raise concern about physical abuse. But like we've talked to before, you guys, about physical abuse, it may be something like they just really truly did accidentally bump themselves, or they may be on a particular medication. Look in the needle for needle marks or tracks from intravenous injection of street drugs, and it may be visible on the antecubital fossa or forearms or any other available vein. Like I told you guys before, I've known people to inject in between their toes and stuff like that. So, yeah, you need to be aware of those type of things. Okay, so often upon assessment, there is a wasting, such as a sunken eyes, hollow cheeks, exhaustion, and defeated expressions. What type of look is that? Um, that's a cachectic appearance. Acromegaly and Cushing's and Hashimoto's. We do have in your book, there are examples of people having various type of appearances. There are pictures of them, and like for Cushing's and acromegaly, you would know that like when that's like for instance, acromegaly is somebody having very enlarged features. A lot of times I hear when a person has problems with their growth hormone of such, and once they have that, it's hard for it to go back. If a person has cachectic, it looks like they're really all sunk in, and you know, if a person has Cushing's, like appearance, it's that little round head, kind of like CeeLo Green, and they usually have a fat mid area. So just knowing those type of things. So when you palpate the skin, right, you always palpate for color, elevation, pattern, or shape, um, location and distribution on the body. You want to notice whether or not they have any pus, what they call exudate, or no color and odor. It may be a teenager and they may just really truly have skin based on them having uh, uh, um, acne, or whatever. So you're going to be aware and you're going to notice all of those. We discussed about the use of the wood light a little bit earlier and what it shows. So you're going to look and you're going to look if the skin is even. You're going to look if it's fine, thick, shiny, or dull. Distribution of the hair, if it's even and symmetric. And you're going to look and see if there's any lesions or ticks in the scalp. Um, we already talked about the profile sign, and we've already talked about the nails and the nail beds and the less than 3 seconds as far as peripheral circulation. So you want to look at all of those type of things when you're assessing your person. So, parenchyma is defined as basically it's a lot to read here, so I'm just going to tell you it's D. It's an acute bacterially tender, red, swollen inflammation of the nail folds with pus in the proximal nail fold, and it's chronic. It's due to wet work. It's due to a person who has their hands in the water all of the time. Okay, I want you guys to be real able to know whether or not just kind of go by my checklist with the test, but also just kind of look at your um book and look at some of the little different areas and different things that they have that's going on. I told you guys about the different color changes, but then there are like different um, there are different things that goes on as far as when you see a lesion. For instance, um, there's a terminology called annular, ANNULAR, um, where the circle begins in the center and it spreads to the outside or the periphery. And you'll notice that with a ringworm or something like that. If it's like the lesions are what they call confluent, that means they run together. That would be like with hives or something like that. If they're discrete, that means it's an individual lesion, which is like skin tags or acne. Okay, so it's very important that you just kind of keep up with what those type of things are, know about um, if it's a group, if it's target, if it's linear. um, they have what they call zoster form, where it's on one side in a linear arrangement. Like for instance, a person with herpes zosters. So those are type of things that you may want to. I'm not telling you that you need to memorize it at this particular time, but if you hear about it, to just be aware. So you can look under shapes and configurations, and you can see whether or not something is grouped or it's clustered or something like that. Is it a vesicle? Is it a macule? Is it flat? Is it a nodule where it is hard or soft and it pokes up above a centimeter? Is it a wheel, which means it's raised and superficial? Like for instance, when you get a mosquito bite, that's a wheel, you know, that type of thing. Just knowing like a vesicle is kind of like something that's like a blister, and then fluid flows out of it. It's really important to know what these type of things are. A person can have an excoriation, which means that it's just an abrasion. So you will hear these type of terminologies. I do want to mention one thing. They do tend to grade um, skin areas in stages, and it goes from stages 1 to stage 4. Stage 1 mean that it's localized and it's just red, and it's unbroken. There's no break of the skin. Stage 2 means that there's a little bit of epidermis loss, and you can see down to the dermis. Okay. Stage 3 is what is more or less like a pressure ulcer. It's full thickness and it extends into the subcutaneous tissue and it resembles a crater. Okay. And then when you get down to stage 4, that's full thickness pressure ulcer, and you're going back into the muscle, tendons, or bone. So you'll hear people say those different things. So just like you to have some type of notice of what those are. And then there are like several different types of little scars, and you'll hear people using different things like spider or angioma, and that's just when the little uh, capillaries come to the surface of the skin, and you'll see people with that's pregnant on their abdomen, or you'll see it on older people's skin and that type of thing. you know Strawberry marks, you'll see a raised bright red area. Um, you'll port wine stain, which looks just like that on somebody's skin, and it's present at birth. So there's different types of variations in people's skin. There are different types of dermatitises and uh, 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 things that show in people's skin. And I want you guys to just kind of look at them and just look at how they look on a person's skin, and not necessarily be like real aware of it, but there are some pictures that are shocking, and if you just take the time to just go over them, I mean, even things like um, I don't know, alopecia, a person losing their hair, they got different types, you know, so you need to be I had threw one of the questions in there about parenchyma from wet work. There's a picture in your book that shows a abnormal. It says it's up under abnormal conditions of the nails. That'll show you how a person's nails look. And a lot of these different things um, are things that basically you're shown. That can tell you that there's something going on with an individual. There's a picture of a guy that has late clubbing, and I actually worked with someone whose nails were like that. And um, you know that a factor is a person having some type of bronchial or pulmonary uh, uh, disease of some sort. So you can look at that and you can be aware and you can see what's going on. So we're going to start with chapter 13 now. And this shouldn't take real long, but I just wanted to start off. Not chapter 13, it's actually chapter 14, but on these slides that I have, they have chapter 13, but it's what I'm talking about is it would actually be chapter 14, head, face, and neck, including regional lymphatics, because of the text changing. Okay, so I had kind of put them together. Head and facial bones. You have your head, which is composed of the skull, and then you have the cranial bones. There are four cranial bones. You have the frontal bone, you guys, the parietal bone, which is like kind of almost like the top of your head. The frontal bone is kind of like the forehead, and then you have the occipital bone, which is that back, and then the temporal, which is on the sides, of the head. So those are the four bones, and then you have 14 facial bones, and one of those is a movable joint, which is your temporal mandibular joint, which you assess for like TMJ. So here is a picture, you guys, of the bones, and you have had A&P, so I'm sure that you're quite aware of what it is. Okay, we talked about in the past about different glands and a little bit about vessels, but I don't want you to really truly get into how it is, but just knowing the location. And so here I'm showing you the location of some of the like the temporal artery, um, the sublingual up under the tongue, and we talked about these. And so that's what I was saying when I was telling you guys that when y'all hear me talk, a lot of things may be like repetitive, and you may hear me talk and you may hear me say, okay, this is this and this is this, and you may be like, she's saying this over and over again, but I'm saying it because I want it to somewhat stick. So Like, for instance, the carotid artery, and you know you got them on both sides, and you know that when you assess the carotid artery, you don't touch both and occlude both at the same time when you palpating. So the temporal mandibular joint is located where? Where is the temporal mandibular joint located? We talked about this. Where is it located? Okay, so if I go back and you look at, think about what I'm saying. Temporal mandibular. Is it at the base of the skull? It's anterior to the ear, or is it the angle of the jaw? Posterior to the ear. Which part is the temporal? Because you know you got temporal. It's anterior to the ear. Okay, so you have the neck, major neck muscles, sternomastoid, and trapezius, and you basically just need to know that those are the names of the major joints. Okay, and here is showing the muscles like the trapezius and everything. So this is a lot of this is just A and P. The sternomastoid muscle is innervated by which cranial nerve? Is cranial nerve 11. Okay, thyroid gland is in the neck. The thyroid gland basically, you guys, I want y'all to know this. The thyroid is probably one of the most dangerous glands in the body if it's not regulated. It secretes T4 and T3, and which is thyroid hormones. Um, I mean, the gland has two lobules, and it's connected in the middle by a thin isthmus, and above that by the cricoid cartilage or upper tracheal ring. And so, therefore, when you're palpating a person's neck, you shouldn't feel thyroid. All you should feel is um, the cartilage, you know, of the trachea and or what they call the cricoid cartilage, which is part of the thyroid cartilage. It's almost like a protection, and it meets the trachea. Uh, it's like a little notch that you can kind of feel, you know, when you're feeling the trachea. But you should not be feeling the thyroid. If you look at a picture of a person with the thyroid problem and enlarged hyperthyroidism or multinodular goiters, um, it's like protruding, and then you know that there's an abnormality. So when you're assessing, you don't expect to feel a thyroid. So make sure that that's what you're looking at. If the nurse wants to assess the submental lymph node, he or she will be palpating which area? Is it the base? Is it midline between the tip of the mandible, halfway between the angle and the tip of um, the mandible, superficial to the? It's definitely either B or C. So um, it's gonna be midline behind the tip of the mantle. Okay, so here is what I was talking about when I was talking about the pictures of the thyroid and that type of thing. Lymphatics. Lymphatics is very, very important. And the reason why, you guys, the lymphatic system is so important. And you'll hear people talk about it, like when they talk about somebody getting cancer or something like that. And they're wondering whether or not it basically has spread um, to um the the lymph nodes, and they're wondering like, wow, if it has, because of the actual purpose of the lymph nodes to fight off infection, to fight out things that are um like invaders into your body. Well, then a lot of times if you get cancer, so you get a nodule or you get something like that within it that's not supposed to be there, then what happens is that you can't no longer fight, or it disrupts the action of that particular thing. So that particular lymph node. So that's the reason why you're just assessing, and you're like you walking down the yellow pages with your fingers. You use a little walking motion, and you go and you assess the lymphatic system, you assess the vessels and the nodes. The greatest supply being in the head and the neck. And that's the parts that you'll see that you're assessing for. So when you're going down, you're starting and you're doing it. You're saying, okay, I'm going to assess these lymph nodes, okay? And you're walking down, and here is showing the drainage patterns of the lymph nodes. So you're assessing the lymph nodes and you're saying, okay, I'm going to do the occipital, which is at the base of the skull. Okay. And then I'm going to do the posterior auricular, which is the back of the ear at the little bone. I'm going to do the pre-auricular, which is in front of the ear. And you're walking along, you guys, and lightly feeling just to see. Because if you feel a nodule, it'll be very apparent. You're going to do the jugulo-digastric, which is right behind the angle of the jaw. The submandibular, which is tucked up under the jaw. The submental, which is at the very tip of the jaw. The superficial cervical, which is in front of the sternomastoid muscle, and then the deep cervical, located behind the sternomastoid muscle. You're going to do the supraclavicular, which is along the top of the clavicle, and then the posterior cervical at the what they call the chicken cutlet of the neck. So that's how you walk. And if you don't remember them all, you know, that is perfectly um, okay. It's 10 of them. But if you look at where they're located, it'll take you there and you'll be able to, like walk. And here is actually a picture, so you find the best way for you to say. And you can look at your notes and stuff like I had y'all do. And a lot of y'all did okay, you know. So, which assessment technique is used to assess the thyroid? Of course, it's palpation. And you're assessing because you don't want to palpate it, right, you guys? You don't want to feel no thyroid. Thyroid is not a good thing to feel. Okay, so then you're inspecting, and we already talked about looking at the head for size, shape, symmetry, looking for obvious lumps or deformities. You're looking at all these different things. Um, you want to make sure that the face is aligned. See, all of these things here at this point, you guys, is I guess you could say just looking, if the facial features are aligned, if the expressions are appropriate. You're looking at the neck symmetry, whether or not the neck is this vein distension, or something like that. So, um, characteristic by head tilt to one side and limited neck range of motion to the opposite side. Upon palpation, there is a non-tender, firm mid-muscle mass. Limitations may include asymmetry of the head and face and visual problems. So you want to know if that's a simple diffuse goiter, a multinodular goiter, Graves' disease, or torticollis Rhineck. And the answer, you guys, would be D, Torticollis Rhineck. And you can see a picture of this along with the other things that's in there. So you're going to do palpation. You're going to look at the head. You're going to do the lymph nodes in order. You're going to do the temporomandibular joint, and you want to make sure the person can do range of motion, and then you're going to press your fingers and you're going to tell them, basically to clench their teeth and see if there's any popping or anything like that. You're going to assess the carotid arteries, and you're going to just put your two fingers there lightly on one side at a time, and you're going to know if you feel it. Trachea is midline. You don't want any type of tug, which means that it's going off to the side. And then thyroid, no masses uh, or nodes or anything. And then the thyroid is non-palpable. So frontal and facial sinuses, you did that, you percussed over it, you made sure it was non-tender. And then there is no auscultation at the point, but we'll be adding auscultation of the carotid arteries later. Okay? When you auscultate for the carotid arteries, you really truly don't want to hear nothing. So this right here is a picture showing how an individual can see if this midline, and you're palpating, and you want to just make sure that there's no tug that just kind of stays there. Okay. And then you will do what you call your health promotion. And it's easy to do health promotion, you guys. If a person you feel, oh, everything is wonderful, I don't see any type of abnormalities, I don't, everything is freely movable and stuff. You can't feel the thyroid gland. They're not having any problems with their lymph nodes. They're doing great. Then think of something. Think of something. Like right here, wear a helmet doing activity. For instance. Like for instance, if a person's riding a bike or something, just tell them something. You assessing the skin like we talked about earlier. Wear some skin um something to protect your skin from the um, sun, that type of thing. So in my blueprint, you guys, I do totally have pointed to the areas where I think it's the most important for you to be aware of. Like for instance, there are things that you see, like for instance, uh, that the babies have what they call fontanelles, and that's because the skull have not clearly fused together yet, and that's what they call the soft spot. You know, it'll be a little because the age of the edges of the cranial bones have not or not well defined yet. So you'll feel that, and it'll close. It usually closes but by no later than 2 years old. No later. But that's like a normal like variation. So okay. So different things like that. Just more information to give you. Okay, so have a good one. Thanks, guys. Bye bye.